Hi, good evening, everybody. I'm a practicing respiratory physician at one of the hospitals in Middle East. I'm originally from India. So there is a question about COVID-19 and immunity among different society, different parts of the world in the society. So when you examine, it is surprisingly number of cases in India until now it is low, which is a very good sign. Like a very promising thing. So, how we differentiate ourselves from other parts of the world where the Western world have so many patients and so much mortality? So, there are different factors which contribute to this less rate in our country. One, of course, we went to complete lockdown. Apart from that, we have any immunological or immunity advantage compared to other population. So when I see there are difference in the strains which affects the Western world and the East, like type A strain is very common among the COVID infection in the American population compared to type C strain most in the Eastern population. So the severity of illness is more with the American or Western people, Western patients. So we are or originally we have an advantage. Then comes our food habit, which helps, like we have a lot of spices and all these things in the diet. Probably that's also helping us to have some sort of immunity inherent in ourselves. Second, we are exposed to so many infections in from our childhood, from the rotavirus, diarrhea in early childhood to tuberculosis, malaria, plague, so many infections. So this gives some sort of immunological challenge to our body, which may have an impact on development of immunity in our case. Moreover, that there are certain studies where universal immunization, like a BCG immunization, is undertaken. The number of rates of coronavirus infection is less in that population. So there are certain observations like that. How much it is true, we don't know exactly, but there are certain observations in that sense. Then comes we have something called human leukocytic antigen (HLA). These HLA alleles are different, and our country is so diverse. So the HLA alleles may be diverse. So one part to another part to spread the infection, this differential ability of the HLA may be playing a role in providing some sort of immunity to our people. Then comes how we will build our immunity. We can build our immunity by proper exercise, proper diet, and proper thinking, like without much stress, tension. Like anxiety kills a man 100 times, but the disease kills only one time. So we have to develop a sort of optimism in ourselves that we can fight this COVID-19 situation very effectively. This we have to culminate in ourselves, this confidence, which will help us to boost our immunity in our body, apart from food or anything. To be precise, we need more water than any other food. So the balanced diet plus an importance to the water, dehydration is not at all good. So we need to hydrate properly rather than any sort of magical food combination which helps in combating coronavirus. Having said that, we need good amount of protein in our body to fight any sort of infection. So consume more protein, less of sugars and all, which will help us giving some sort of energy to our body. Then comes, actually there are a lot of confusion in my clinic because I'm a lung specialist. So many people with asthma or something, they comes to me regularly, but now they comes with some sore throat, and each sore throat they think that it's because of the coronavirus, which any intelligent person know that maybe sore throat of 2 to 3% in a total population, even that is an exaggeration. maybe 1 to 2% of sore throat can be due to coronavirus, but remaining 98%, even in our population where there are a lot of number of cases of COVID-19 is too much, 98% can be due to some other things like our usual common cold or influenza or even sinus infections, which are the common reasons of the sore throat rather than coronavirus. Coronavirus will have a sore throat followed by the cough, but again I'm telling that the cough can be due to so many other reasons. Then they have a sort of breathing difficulty, then muscle ache, body pain, loss of smell. Some people have some skin lesions, some skin changes, some loose motions. It's a different situations. Maybe in India you are not facing that much. We face lot. So, but it is not that common. Again, it's not common. I have to again and again tell you it's not that common. So certain lot of other diseases which gives rise to this sort of issues rather than coronavirus. Then how we cope up with the corona situation in our community, in our society. The problem is that corona is not the exact issue. The anxiety is the exact issue in our community now. How we will overcome this anxiety? First of all, to conquer anxiety, we have to know that anxiety in this situation is normal. It's not abnormal. We are not psychic to have anxiety. Every person will have anxiety. Basically, we are watching television, we are watching WhatsApp, everyday WhatsApp videos, which gives us only, actually, to be precise, I am sad that most of the WhatsApp videos give you like false information about death of the patients, and so much negative news they are spreading regarding the COVID situation. So you should not be like believing all this negative news regarding death of the patients and all these things. Few people are dying, I agree with that, but compared to the mortality, if you see the Indian scenario or in the East, the death rate is less than 1%. Like now 20,000 people almost in India, like around 500 deaths. So it's not even coming to a big percentage like in America or something. The only thing we need to worry is that we should not spread infection to anybody else. So that we have to be very, very careful to follow hygienic measures. Because if a society completely get COVID infection, there will not be any doctors, any nurses enough to treat them, and there will not be any enough hospital beds to treat them. This is the real tough situation rather than an individual get a COVID like situation. So an individual, for example, below 55 years, most of the people will not have any serious impact. Some sort of breathing difficulty, cough and all they will have, but they will overcome it. But the people who are very high smokers or they are above 60, 65 years, they have some difficulty. So our duty is not to spread the infection to our elder population rather than worrying ourselves. So to avoid worries, we should start indulging on some sort of exercise program, yoga, mindfulness, so many things we can do it. And as a diet measures, I told you, increase the amount of water we consume and to indulge in positive news rather than negative news regarding COVID situation, and a strict vigilant watching, because some countries already first wave is over, second wave comes in a vengeance, like the number of cases comes more. So we should not be relaxed. After the lockdown, no country can lock down forever. So after the lockdown is over, we should strictly abide by social distancing, what Canada is doing. Like each person will be walking like 2 meters away from other person. It's very difficult in crowded cities in India, but still we can practice personal hygienic measures, social distancing, putting mask. I am putting mask here because I want to talk to you. Otherwise, I am putting mask all the time. And we need to have this culture of putting mask another 3 to 6 months all the time while we are going for work. And don't board crowded trains, and don't go out of your house. Even if lockdown is finished, don't go out of your house unnecessarily. with for recreation and all these things, please don't go out. You have to think three times whether I need to go out of my house or not. This is to protect your father, your grandfather, your grandmother, your mother, rather than any serious illness for you, and to help the hospital workers like me or my colleagues to combat the infection and to control the infection, and to not strain the healthcare system, which is needed for so many other things as well. So please be patient enough for some time. We will get our life back without any doubt, but we need to patiently wait for that time which will come sooner. But 3 to 6 months we need to put mask and hand hygiene, soap and washing the hands frequently with soap and water. These things we have to follow. Thank you for your patient listening. Thank you very much. Wish you all a healthy life in future. Thank you so much.